Hello, and welcome to Tea with Lily show. We're still on the AI series, and we have various people wanting to know more about this AI thing. And this is episode 2 in the AI series. My name is Lily Najamensa. I'm your host for this evening, and I have another job, which is a brand strategist by night. So we have a fabulous show, and we have Bamidele Farinre, who has joined us to tell us a bit more. Bami, how are you doing? I'll call her Bami because she's my mate. How are you doing today?
I'm fine, thank you very much. Thank you for having me.
Great. Now, listen, it's been a very busy week. We've had Ghana Independence Day yesterday. And those of you in Ghana, give us some love in the chat. Those of you from Ghana, regardless of where you are in the world, give us some love in the chats, whether you're on LinkedIn, Facebook, or YouTube. And tomorrow is International Women's Day. We have a lot of things going on, but the month has started. So happy International Women's Day in advance. And yesterday we had the budget, UK budget. Well, that is the show for next week, and we'll come back to it because I'm sure we'll talk about business and how the UK budget will affect us. But without further ado, I will introduce the show. Tea with Lily is a space for informal discussions where the great and the good join me on the magic sofa to discuss everything from how you get on in work and in all walks of life, how you do better with yourself. Today's topic is very topical, and that's what Tea with Lily is all about. We're going to talk about AI and ethics in healthcare. We all need healthcare at some stage, so everybody needs to understand what happens behind the diagnostics and all of that. But Bami will give me all the info, give us all the info. And today we have the guest is, as I mentioned, is Bamidele Farinre, and she's a biomedical scientist and a STEM scrum master. She'll tell us all about that. So welcome to the Magic Sofa, Bami. How are you doing? What are you drinking, first of all?
I decided to go with water. I had so much tea today, so I thought.
Okay, so yeah. It's water is good. Water is always good. I'm not having tea, but I'm having water as well. But mine is laced with some pieces of lemon and mango. It's not GNT, I promise you. It's a little bit too early for that.
Maybe I should have done that. But yeah, it's room temperature, so yeah.
Yeah, it's room temperature. So listen, guys, wherever you are in the world, I'll see if I can, my prompt thing is working so that I can read some of their comments. But there we go. I will limit this so we can let me get the comments in and see where I can see more. So all the comments, and let's go to LinkedIn. I may have to go on LinkedIn to get the comments, which is quite annoying that I can't see the comments, but I can see people are watching. Now Wilson is watching, Richard Cunningham is watching, Abeku Bachman is also watching. Thank you very much for joining us. Now, Bami, we are going to talk about healthcare services, and you have all the tips and tricks based on your experience. So let's sort of have an overview of what you've done so far, and I'm just going to read a short, brief intro to your background. So let me read this one. It says, Bamidele Farinre epitomizes excellence in the fields of biomedical science and STEM, showcasing remarkable leadership that has earned her numerous accolades, including the Biomedical Scientist of the Year 2022 at the Advancing Healthcare Awards. She's also a chartered scientist and certified Scrum Master. As a pioneering Black British female leader, STEM ambassador and mentor, inspiring the next generation of leaders. She's also serving as a Freedom to Speak Up ambassador, school governor, BAME staff voice representative, and deputy chair of IBMS Virology Specialist Advisory. She tirelessly advocates for a fair and inclusive workplace environment, amplifying the voices of the underrepresented groups. So, welcome, Bami, to the Magic Sofa, and let's get talking about AI.
Thank
Now,
you.
what does a biomedical scientist do? Please tell us.
Yes. So, a biomedical scientist works in healthcare. They can
Mm-hmm.
work in different areas within within science, academia, or research. But my specific industry is in the labs. So, as a biomedical scientist, I work within the pathology for diagnostic service provision,
Mm-hmm.
and my specialty is in virology and microbiology. So biomedical scientists, we help the doctors. So
Okay.
we save lives. And how do we save lives? While we're not patient facing,
Mm-hmm.
we test patient samples.
Oh,
Yes.
okay.
And so the samples that we test, that's the patient to us. Each
Mm,
sample represents a patient. So we would treat the sample as we would if we were seeing the patient face to face.
mm.
So,
Okay.
yeah, so what we do, for example, if you were to go to the doctor with
Mm-hmm.
symptoms,
Mm-hmm.
and they would have looked at your symptoms to kind of categorize and see like what kind of what kind of infection or what kind of condition that you have. When
Yeah.
they're not able to get a straight answer, for example, if you go to a doctor and they can see, like, let's say you have chickenpox, they can easily know that it's chickenpox,
Mm-hmm.
because of the presentation, the symptoms that the
Oh,
patient
okay. Yeah.
present.
Yeah.
But there are some, like, but somebody can go there with a rash that doesn't look like the typical chickenpox. Then they would need to do the differential. So they would need to know exactly what kind of rash it is and what virus or what bug, we will call it, is causing that kind of rash in the individual. That's when we come in. They send the sample to us in the lab, and then we'll test it.
So,
Once we get the results,
mm,
we then send the result back to the doctors, who is
yeah.
then able to have a definitive answer as to, okay, yes, this is what is going on. No, this is not what's going on. And if they're not able to, if what we tested for is not what is wrong with them, then of course they will do further tests.
Okay, so you're actually the people behind whatever the doctor tells us. So basically, we should stop worshiping doctors. Doctors are just taking instructions from you guys. You
I
must have
call
been
us
very.
the hidden heroes of
You're the
pathology
hidden
and healthcare.
heroes.
We
You must
are.
have been very, very busy during COVID as well, because
Absolutely.
yeah.
Absolutely.
Okay.
Absolutely.
So, what are the current trends in AI in terms of testing this kind of work that you do? What are the trends in your industry?
I think I would like to take us back a little bit.
Okay.
So I remember when I started in the industry.
Mm-hmm.
I mean, that was not too many decades ago, but everything was mainly like manual. So I
Mm,
worked in the virology lab and in the microbiology lab. I was multi-trained.
right.
So, and I specialized in the virology discipline. So in virology, we used to do a lot of testing, like they were like manual. When I say manual, they're like laborious, manual
Mm,
intensive, where like imagine how busy we are and then having to test for a patient sample, doing it individually. I'll
right.
give you an example of if we want to diagnose for a respiratory infection.
Right.
To do that, there are more than one virus that is responsible for causing viral infection, specifically respiratory one.
Okay.
So we used to do what is a method that is called immunofluorescence. So that means we
Can
will
you
get a
repeat that, please?
immunofluorescence,
Gosh.
immunofluorescence.
Immunofluorescence. Oh gosh.
Yeah,
Okay. Carry
fluorescence.
on.
Yeah.
Carry on.
So it's like a slides that
Mm,
then we have to prepare the sample. So
right.
we the sample that we use is called nasopharyngeal aspirate. which is, let me just shorten it to NPA,
Okay.
nasal pharyngeal aspirate. Basically, is a nasal sort of taking like snots,
Okay.
but deep down into the lungs. That's what we used to do so that we can be able to get proper material, enough material to be able to do the test.
Yeah.
And imagine each slide has at least, including the controls, has about 7 to about 9 tests,
Right.
different viruses. Yeah, and that's one slide per patient. Can you now imagine, let's say even in the times of COVID, when we had to do like thousands of samples, having to do that manually one by one, what
Yeah.
you can imagine what's gonna happen.
Mm.
So that was how it was back then, having to do. So that means for patient management, that wasn't good enough
Yeah. Because
because
the
the way
volume was high.
the volume was high, and then the time that it would take for them to get the results was long, basically.
Mm.
So that is where, if you're thinking, then automation came in. So that's where our AI came in, automation
Okay.
and robotics. And it didn't just come in one swamp like that. So it was in stages. So we were still doing partly manual and partly automation, but that helped. That means we could have a higher throughput than we would if we were doing like, so which means if we were just doing that one slide per patient, we could, and then each procedure takes at least nearly 2 hours because they have different steps. So it's not
Okay.
like, yeah, it's not like you just prepare the sample and then within minutes you get the results. No.
Okay.
Yeah, it takes time. There are stages. You have to then, prepare the sample. Once you prepare the sample, there's incubation stages. When there's so many different stages that at least it take 1 hour, 30 minutes or so, 2 hours
Per sample.
per
And how
sample.
has AI improved that?
Oh my goodness. So now you can test like thousands of samples within like, 2, 3 hours.
Really?
That's
And
that
what technology? You've all had to be trained in that technology in order
in
to
that
use it, I'm assuming.
exactly. So can
Yeah.
you imagine? So that means we then had to develop our expertise basically.
Very
So
quickly.
yes,
Yeah.
we very quickly we had to be trained in using the machine, the robotics. We call them robotics because so the tests that we would do normally manually are now being automated. It still
Okay.
requires our input because we still have to prepare the samples to
Mm-hmm.
be loaded onto the machines, the
Mm-hmm.
robots, the robotics, and then we still input what we want, what test we still select. So it still requires a lot of human input for you to
So,
be able to get results. But you
so
can do like, mhm,
does that mean that as much as it's helping you do your job quickly, you're able to do more? And
yes,
what are the sort of, and I know we'll probably go get there, but we're here, so I'll ask that question. Does that then become an issue about people's jobs? So are you scared for your job, for instance, with this AI doing thousands of saving you
mm,
thousands of hours in a
mm.
day, you know, in a week or in a month or in a year?
I think initially that was an issue because I remember there was like some few years back, there was this panic within the healthcare, especially in the biomedical science
Mm,
field that, oh, now automation, they're not going to need us, they're not going to need our expertise, they're just going to be using, lower grade staff.
mm,
Because in pathology, we have different grades of staff. So I started at entry level, you would call it like, entry level into a role. So as a medical laboratory assistant,
okay,
before, of course, getting trained and developing into a specialist in the field.
right.
So a lot of the jobs, so the way it worked then, mainly biomedical scientists are actually doing, like the work that I was saying, preparing the samples and then
Hmm.
getting the result. It doesn't just even stop at just preparing the sample and testing the samples. Then you have the result analysis. You have to make sure that you have the result, the accurate result out for the right patient, in a timely manner. And then
Hmm.
so then that was being done by qualified staff. When we say qualified, registered biomedical scientists, because
Like yourself.
yes, so as biomedical scientists, we're registered like the doctors as well.
Yeah.
You know how the doctors they practice with their pen. We likewise we are registered with the it's called HCPC.
Okay,
Healthcare
that's what it is.
Professional
Okay.
Council. Yeah. So so going back to the jobs, we were thinking, oh no, once we have that, we're not going to be able to do anything. But no, there's so much to do. You'll be amazed. There's the paperwork to do. There is, other things, preparing for other samples. So there's like, the day is not the same every day, basically. And then you find that you can't even leave the machines unattended, not for
Okay.
too long.
What
So
would
while
happen? What would happen if you leave it unattended?
Well,
From
I mean, when I say unattended, it doesn't mean that you can't still get your 5 minutes or so away, but
mm.
you need to make sure that he's doing what he's meant to do because it can
Get to watch it.
malfunction. Yes. We call it babysit. You know what we do sometimes in the mornings when we go in, we touch them. Actually, we name them. Yeah. So each
Mm.
machine has a name, like a kind of character, depending on the staff in the lab. And what we tend to do, I do this a lot, and a lot of my colleagues I know they do that. We'll speak to the machines, please behave today. Like you're gonna have your
Yeah, yeah,
TLC
yeah,
today. Nothing go, you understand? Because if they
yeah.
malfunction, oh boy, And then when they break down, we used to revert back to the manual
Oh,
way
okay.
of
So
doing things.
that is on standby still.
Yeah, that was on standby, but now we don't tend to do that anymore. Then there's if that happened, the samples are referred to other labs for
Mm.
testing.
Okay. Now, just quickly, what took you into this area of work? Why did you choose this?
It's funny that you asked actually. You know what, funny enough, I wanted to be a pharmacist when I yes, when I
Okay.
yeah, from a very young age, I wanted to be a pharmacist. I did. So but it just so happened that, the universe didn't agree that I should be a pharmacist. The universe agreed that Bami should be a biomedical scientist.
Okay. Okay.
Yeah, exactly. So that was that. But to be honest with you, I have actually loved it.
Mm.
My training had been like, I'll say this. We used to say that the way I still say this, when I was trained, I am so glad I was trained in that time period because things have changed so much now. A lot of the
Right.
techniques that I learned, the expertise that I learned, it's not the same now, basically. Like if
Right.
somebody was coming in now to become a biomedical scientist, the training is different. What, like back then, you have to know your stuff. Let me give you an example. When we do enteric virus diagnosis, we used to use something called electron microscopy,
Okay.
EM.
Big words again.
It's so just very simply, it's like looking down a microscope, basically. And then
Mm.
you have to prepare. Oh my gosh. I mean, you need to experience it to see, like it was fascinating, basically.
Mm.
Very tiny grid like this. Like literally, like speck,
Yeah.
yeah, that very tiny grid. You have to prepare a sample for it. You need to know the
Mm.
amount of sample. Is we use stool sample. You need to know the amount of sample to use, to get the amount of material on that grid. Otherwise you won't be able to read anything down the microscope.
Wow.
And then it's not just looking down the microscope. You need to know what virus you're looking for. Some of them, they look so similar, you could hardly differentiate. So that was
Yeah.
how, the technical expertise that was required then. But now
Mm.
you don't need to. We don't need to do that. The machine, you just, it's already been. How do you say it? Everything is in there. You know the
It's been
target that they're looking
pre-programmed.
for. Be programmed. You just put the
Mm.
samples in, put in reagents and everything. You get your result basically. You
And
don't
that's
need to.
it.
You don't need to know whether if it's real or not. It gives you the answer that you need. Whereas before, you
Mm.
need to know your virus. You cannot afford to miss it basically.
But isn't that interesting that those of us, like it's probably a bit like driving. First of all, you had to drive a manual car.
Hmm.
Now everything is
Electric,
apparently
hybrid.
most people are driving automatic cars now, so manual
Mhm.
cars are not being made as much. And very soon we'll have driverless cars.
Mm-hmm.
Oh my
Mm-hmm.
God, can you imagine? I think
Mm-hmm.
I'll freak out if I see one of the. I haven't seen one of those yet, but that's what the future is looking, because
Mm-hmm.
machines can do but a lot of stuff that we
Yes.
cannot, a lot of stuff that we used to be able to do.
Mm-hmm.
So I guess it's that sort of thing. But there's nothing. I think for you, because you were trained earlier, you probably have the knack to know when the machine is misbehaving. What are the things that are put in there to make sure that uh, what the machine is saying is correct, and the human that is supposed to be babysitting it knows
Mm-hmm.
when the baby is not doing what the baby should be doing?
Mm-hmm. Mm-hmm. Yeah, so there are measures put in place.
Mm,
Like, so robots, the machines that we use, they're trained, right?
hmm.
So data is put into it, data from, years of research, from what we've known. So it's evidence based.
Yes.
So we know what is expected. We know, for example, let's say if you take a sample for somebody that is, let's say somebody that has diarrhea, yeah,
Hmm.
compared to somebody that doesn't have a diarrhea.
Mm,
You know what to expect as a
yes.
result. You know that definitely somebody having diarrhea could be caused by several different things. It could be food poisoning. And what's causing that food poisoning? Do
Mm,
you understand? Is it a bug, or is it something that is wrong within the system? So all this information is programmed into the machine.
yeah.
Yeah.
Okay.
So there's a reagents, there are controls for them to be able to say, look, this is what the target should look like.
Mm,
If a sample, if a patient is possible for a specific virus, it should look like this.
okay.
So we
That's
have
quite.
materials that mimic patient samples.
Oh, okay.
Yeah, so those are
Hmm.
used as controls. Those are used as materials for the validity and accuracy of the results that we produce, because we, even though machines are doing it, the machines cannot afford to get it wrong. So
Yes.
whatever programming that has been put in there has been done by people that are experts in the field,
Okay.
knowing
So,
exactly. So but when it comes to malfunctioning, like for example, now if you have a patient that has come in, and you know that definitely previously this patient was positive
yeah.
for, let's take for example, I don't want to, let's say maybe HIV or so.
Yeah.
Yeah.
Somebody has answered that question. I asked that question. LinkedIn user has asked that question now. So I've put that on there. What
Mhm.
happens if one of the machines malfunction? So carry on.
Yeah, so I'll carry on. I
Mm,
mean, yes, so like I was saying, you would know definitely which one is the right result, which one is the wrong
mm,
result. Sometimes it's based on previous results from the patient, especially if
right.
somebody is still actively sick. So there are
Mm,
some symptoms that, there are some characteristic basically that you would expect to see in the
yeah.
in the sample. Yeah.
Okay.
So now if we go to when the machines malfunction, what happened? Sometimes we're like, oh my gosh, it's the end of the world. No, it's not the end of the world. Sometimes, so that's where troubleshooting comes in.
Yes. That's where human intervention comes in.
That's when human intervention comes in. And
Okay.
even with that, you would like, you find out, okay, why is the machine malfunctioning? Sometimes we catch just before it malfunctions, we can tell.
Okay.
That's why the babysitting comes in. That's why
Okay.
you don't leave them unattended for too long.
Yes.
Especially
Okay.
like, let's say, for example, if we're doing sample um when we're doing sample processing and the machines is working on it, so you could see there's some open ones, like for example in the labs where I've worked, where you could see when the sample has been taken, when it's been ejected, what it's doing. You could see exactly what the machine is doing. Immediately
Okay.
you see that something, let's say, is meant to go to sample A and it's going to sample B, sample C, you know that something is not right. You could intervene then.
Okay. So human intervention will help.
It is, yeah, it will help. And then if they do break down that you're not able to fix it, because we follow manufacturers manual, to of definitely operate the machines. And in the event that we're not able to troubleshoot and fix the issue, of course, we then call in the technician, the
Yeah.
experts to come and fix it for us. But we try everything that we can to make sure
Okay.
that it doesn't impact on service provision.
Okay. Let me have. I've got a couple of cases that I want to talk about, and then we've got some other questions coming from LinkedIn about diversity. So I went to check with my AI thing on Bard to ask my own questions for you. Once upon a time, I mean, that's the beauty of AI. An area that I really don't have much information on. I was able to ask it to help me formulate some of the questions here. And let's say one of them is about benefits. And this talks about enhanced accuracy. How can that improve the accuracy if as a benefit in AI?
So basically, we talk when I was saying like how we used to do stuff manually,
Mm,
there there is room for error.
mm,
You can miss is easily. For example, when you're so busy, you can easily make mistake.
yeah.
Like
And if
you
you're
could,
tired, if you're
if you're
sleeping.
tired, yeah,
Mm,
yeah, those sort of things happen. So with the use of automation, that can be eliminate, not like totally eliminated, but the possibility for human error can be reduced.
okay, that is fantastic because you can be diagnosed with something completely different, and that can reduce that.
It can
Okay.
reduce that, and it's good for like improved outcome for patients as well. Like I said, they're getting their results on time, and just
Yeah.
ensure that, yeah, they can get early intervention for their treatment.
Okay. So I mean that's fantastic. Now, the challenges, the big challenges. Okay. So, my AI thingy also came up with stuff like bias and fairness. Can you, in terms of the challenges, can you talk to us and can you talk to us about that and how we might be able to find some answers to those biases and fairness?
Okay. So when we talk about biases, for whatever we do as humans, there's always an element of bias. Yeah.
Okay.
So it's the same with AI as well, automation, because it depends on, like, for all the algorithms that goes into these robotics, that we're using,
Mm.
it came from data. Yeah.
Data that has been sitting there, that has been collected
That has been
already
collected
from
already.
past
Exactly.
patients, and
Exactly.
that leads me to the question that somebody posed here. How important? Let me get my specs on.
Mm-hmm.
How important is diversity? I imagine symptoms may be different for people from different background, and if the samples aren't diverse, things could be missed. How do we find ways to improve diversity in the samples and the outcomes for patients from diverse backgrounds?
Mm-hmm. As you would appreciate, like at one point in time, all of us have had to go to use the healthcare. Do you
Yes,
understand? So
absolutely.
take United Kingdom for example, is a diverse nation.
Mm,
So the samples that we would have tested, do you know how many citizens use the hospitals?
yeah.
So you will get diverse samples. Although, having said that, depending on the boroughs as well, we have different boroughs, we have different, ethnic people living in different boroughs.
Mm,
There might be more people, in one borough than the other,
yeah.
but the samples that we test, they are representative of the population that we serve.
Yes. Okay.
So when it comes to symptoms, I mean, the thing about it is chickenpox. Most people will present, the same way because they come with spots. It doesn't matter whether you're black or whether you're white. The
Mm,
spots
yes.
is really pronounced. You can most of the time tell that it's chickenpox. The same with if you have diarrhea as well. There's certain bugs, let me use the word bugs, that are responsible, microorganisms that are responsible for diarrhea. So
Mm,
that would be the same in all. Do you understand? It's like if you have food poisoning, It doesn't matter what ethnic background you are, whether you're female or male or anything like that. You
Mhm.
understand? We will still be able to, detect whatever microorganism is causing that specific symptoms or diarrhea that you're having. So when it comes to, but the only thing that I could say is if it's in the area of research,
Mm.
then definitely it needs to be representative of the groups of the
Okay.
population that it serves. So, that is where like a lot more work needs to be done with regards to who has an input.
Yes,
So
yes, because I think there are times that even with giving blood, certain ethnic groups do not go. We need to go so that we can give
exactly.
blood and more black lives will be saved.
Mhm,
But
mhm.
some, people assume that like leukemia and stuff like all those things, we tend not to go to be part of the solution.
I think this is where
Mm,
education comes in,
yeah,
the general public being educated about ethics of AI.
the ethics. Okay.
Yeah, because if they know that, look, it's not for the bad, it's for the good. It's
Yeah,
the same with vaccinations. We have some people that are not really keen on vaccination because there's so much um
yeah.
around
COVID is an
controversy.
example. COVID
Yeah,
time is an example.
exactly,
Yeah, yeah.
so there is that. But I think it's really important that if you have the opportunity to
Mm,
be part, because it says it's really key for you to have a voice, especially where you want to see a difference and you have the opportunity, be there.
mm, mm,
Learn more, educate yourself. What okay, they keep talking about AI, they keep talking about this and that. What is it about? And I think this is where we come in, especially within my role as a STEM ambassador.
mm-hmm.
Like, I go into schools because you'll be amazed that even though I'm a biomedical scientist, if people ask me, oh, they say, who I'm a biomedical scientist, they don't really know that much. But if
I
I say
did
I'm a
not know
doctor,
until we
then
spoke.
yeah, some people, if I say I'm a scientist, they'll be like, oh, do you miss potion? Or if I say I'm a scientist, they think, oh, are you a pharmacist? Do you understand? So
Mm.
it comes with the general public being made aware. We create awareness. That is why it's better to start young. As you know now, the generation now, they're more in tune with AI than we
Oh,
were.
absolutely. That's why
Technology is
I
everywhere.
want to talk more about it and inspire more people to actually first of all understand what's going on around us
Hmm.
and to participate in the conversation.
Absolutely.
It's
Yes.
about participation because
Mhm.
if we're not participating, nobody's going to hear our voices.
Yeah.
Nobody's going to hear our voices as to how it affects us. So,
Mhm.
I mean, overall, I think overall, I think it's a good thing as long as it is managed properly. And when you talk about ethics, um, if, for instance, somebody's looking, the question around ethics for me is if the machine has done something that you as a um, as a scientist feel that is wrong, because machines can go wrong.
Mhm.
Even my printer here, it might start to print rubbish because there's
Mhm.
no ink in it.
Mhm.
If you as a scientist you're looking at it and you don't speak up and say this thing is wrong,
Mhm.
then we'll find there's this thing about why aren't you speaking up? Is it because of A, B, and C? And that's where
Mhm.
the question mark of ethics, being dependent on the machine too much, might be a problem. what
I'll
what,
give
what
you.
would you say about that?
Yeah, I was gonna say. Let me just give like example. There's one thing we call the taboo word is contamination in the lab.
Mm,
Yep.
mm,
So when contamination happens, it means
yeah,
so there are two things to it. It's either human aspect of it or the
yeah,
machine aspect of it.
okay.
So when contamination happens, when we know that as scientists, we've done what we're supposed to do. We've
Mm,
followed protocol, we follow protocols, standard operating procedures in the lab that tells you specifically step by step what to do. So if you follow that before the samples that you need to test goes on the machine, you've done your due diligence. Yeah. And
Mm,
if the machine now is misbehaving, so example of a machine misbehaving is a sample that like your controls, for example, we
mm,
have positive controls and we have negative controls. If your negative controls start becoming positive, something is wrong.
mm.
Yeah. And then you start thinking, okay, I know. And then that's where the human element of that detective work comes in. You be like, could it be that I put, because that could happen. Or
Mm.
did I put the positive in the negative well? Did I do something wrong? Yeah. And then
Yeah.
you go back and repeat just for you to know that it wasn't you that did that mistake.
Okay. A
So
question has
yes.
come into my mind though.
Mm,
When you do the sample, when the salmon, I know the medical people will know the answer, but I'm just an interested watcher. When you do the samples, does it come from, do you know whether it's come from a particular ethnic group? Do you know if it's come from a senior lawyer somewhere rather than a cleaner? Does it give you the frame of the
okay, no.
person, or
No,
that
no,
is it just plain?
no, this is where confidentiality comes in. So
Okay.
yes, we have, so when the patient sample comes in, we know the patient, like, by the lab number.
Just that's just the
The
lab
lab
number.
number. No, we have requests. The request form will say the name, but it doesn't go into, oh, it's a lawyer. Do you understand? So there is
Mm,
no, because already that's introducing bias into the sample
mm.
testing.
Yeah,
Do you
yeah,
understand?
exactly.
As you know, everybody for with the NHS, you get tested. It doesn't matter who you are. It doesn't
Yeah.
matter your background. Do you
So it
understand?
just comes with a number.
It comes, so no, we get the request form, it comes with a name, it comes with details that we need to know, just minimal details, like maybe there's the patient's condition, previous conditions, or anything, if there is any,
Yeah,
just so that we have
to
an
help
idea
you
to
with
help.
that.
And the
Yeah.
type of sample is it, is it urine sample, is it blood sample, is it stool sample, so because different samples are used to detect different microorganisms. So but there wouldn't be that discrimination of, oh yeah, he's a doctor, he's a high priest somewhere else, anything
Mm,
like that. No.
okay. That's
That is
great.
why I said at the beginning that every sample is a patient. We think as it could be me, because I've used yeah, I've been to the hospital, my
Mhm,
samples have been tested, so the same way that I would expect, the level of service of treatment that I would expect is what
mm.
we as scientists, that's what we provide to our patient population.
Okay. I mean, there's a question here again from LinkedIn, and I'm not sure whether you can answer that. It's an interesting one. Um, it would be great if AI can help people be seen more quickly and reduce dreaded waiting lists.
Uh,
Um, do you know what? I feel that certain things have been put in place, but there's some bias there in terms of the waiting list. If you don't have access, if you're not very good with your mobile phone and being able to upload information and all of that,
exactly.
um, my 88-year-old mum cannot do that. So where does she fit in this new development of technology where you have to send a picture of whatever is going on? How can my
Mm,
mom do that? She needs a second
yeah.
or third person to do it. And I think that might be the problem with the waiting list. But I'll let you answer that if you have an answer.
Yeah, I mean, is there ever an answer for that? AI is work in progress,
Mm,
forever evolving.
yeah.
So, hopefully at some point we will get there. But I think with waiting lists, it has to do with like how many people are on
Are
and
there to
the
do the work.
seriousness, yeah, because there's this thing we call prioritize, yeah. So
Mhm,
when samples come in, sometimes we don't just like test like that, there's
mm,
prioritization mean of samples mean somebody's on the deathbed. If you don't
mm,
get result out in a matter of like an hour or so, yeah, the person could potentially die.
yeah.
So you will prioritize that patient sample
Mm,
compared to somebody that's just come in for a routine check to
yes.
ensure that maybe the monitoring is going well, the regime that, drug management that they're going through is going well. So you could see where sometimes it might feel like um there's I think, like some biases, but you have to, because if you've put yourself in the shoes of, oh my god, somebody's on the deathbed, they need this result ASAP. Do you understand? Then you
Yeah.
have to then prioritize and work accordingly. And another thing with regards to, the waiting list as well, that there's so much pressure now on the on the NHS. And
Yeah,
I
definitely.
think there's just, yeah, there's quite a lot going on. And then I think sometimes people should definitely think about, those that are in the NHS, the sort of pressure,
Mm,
that is on, that they're working on. So
yeah.
yeah, so there is that as well.
Okay.
Well, I mean, I mean, and also with waiting is, it depends, because if you, like you mentioned about your mom now,
Yeah.
it's
Mhm.
true. Like a lot of people, even me, even though I know how to use the technology, I'll still be like, oh my gosh, before you could easily just pick up the phone and call your
Yeah.
GP, and then you tell them what is wrong, and then you go in. But now they ask you, they do triage, and you're like,
Oh
yeah,
gosh. I mean,
before you even get an appointment. So when you start thinking about it like that, then it does put some people off, because then
yes.
they start thinking, where's that human element of something is wrong, I just quickly need to see my doctor. And then,
Yeah.
so yeah, there's a lot of work still to do in that area.
Yeah, and I think when the somebody just said there's a digital divide because of those who
Yes.
can and those who cannot, or just I can't be bothered to just wait around
Mm-hmm.
for someone to come and see me. So let me just say hello to a couple of people that I reckon, lots of LinkedIn questions here, but I can't see who they are
Oh.
from here. So, good evening. Oh, psychic and esteemed invited guest. I know, I know it's going to be awesome. And then, hello, Lily and Bami. Thanks for sharing your wisdom. Yeah, we'll put that one up. And glad to hear that humans are still needed. That's amazing.
Absolutely.
Yeah, humans are still
Absolutely.
that is a really really good one. And then, do robotics ever get it wrong? We mentioned that earlier.
Yeah.
And
Mm-hmm.
then let's see what else. And this, like, somebody's written an essay. Oh, this is really interesting. Let's see if I can read all of that. I'll put my glasses. I remember going to the bank after COVID and seeing all the machines where the tellers used to be, and the bank staff were cleaning the machines. It did feel like they'd been de-skilled. The idea of having to keep an eye on the machines and ensure that they don't malfunction makes it feel like it's similar experience. Maybe we need to reimagine work and life now. I am up for the 5 day weekend and 2 days of work, as long as it's the same salary. Oh gosh, I wish I knew who wrote this one. It's amazing. So Olu is there. Let's see who else. And more comments coming in. Hello, Constance. The Facebook people I can see, LinkedIn I can't see.
Mm.
Pat, hello, Pat, and Jenny. Oh, hi, Jenny. Jenny. Hi, Jenny, and hi, Saz. Thank you so much, guys, for joining. We've had a really, really interesting um, conversation about AI and ethics. So, what are the sort of tips that you can share with us before we round off?
I think, which I mentioned earlier, is important to be aware.
Mm,
Yeah, because, and how do you become aware? So, the news is filled with, with a lot of information about what is going on, the new technology coming out and things like that. And I think when you hear AI, don't think about a no-go area,
mm.
because we use it every day. Like, for example, our phones, all the things that we use, because when people hear AI, they just think something different. But I think we should bring it to our everyday life, like your toasters, your fridge, your cars, you were talking about. So just think about, how can I use it? What can I use it? How can I use it to my benefit?
Yes.
How can I use it to be more responsible?
Mm.
You understand? In what
Yeah.
way can I use it to improve maybe your health, to improve your knowledge? And in areas where you feel like, oh, more still need to be done, if you have the platform, talk about it.
Yeah. Yeah.
You have
Like,
to talk about it.
come and do LinkedIn Lives with me and then come and talk about
Yeah.
it. We're here to
You know,
share, we're here to learn. Um,
yes.
so, Bami, you will have to come back and talk to us because I'm sure technology is moving so fast. So, this is not the
Mhm.
last time we will hear from you. So, those are the sort of tips that you've shared with us. We need to get involved and so on and so forth. Now, what is next for you in terms, or even the industry?
No, like I said, there's development like literally every day.
Mm.
Every day new things happening, but we're still trying to keep up too, because I mean, I can tell you that I don't know about all the new developments that's been happening, but at least the ones that I know, I'm thinking, oh my god, let's learn this. I'm not even over this year, please. you know
Yeah,
before you start introducing new ones and all. But I mean, it's just to keep learning, and I think more for me, more importantly, is to create awareness and educate the general public, because it's
yeah.
really key that we have the right information.
Exactly.
No, it's
Um,
really key. Yeah. So just creating the awareness and getting the correct, accurate, evidence-based information out there to the public, I think it will make a lot of difference.
Fantastic. There's one comment here, one final comment here that I'm gonna. My daughter is a biomedical scientist as well, and I hear her talk about
Over
sometimes the machines and these things. How do you deal with that? And in those circumstances, how do you ensure that the previous reports given is accurate, spot
you-
on?
we always check results. We always make
Even
sure
I'm overheating.
no, you know what, and so that's where the human in intervention comes in.
Mm.
For every result that we send out, we have to ensure that is correct before we send it out. That is why there are measures that are put in place. I mentioned about controls put into the that we put in all the time to make sure that something that you expect to be positive is coming out positive. And in the situation where you're getting inconclusive results, we go back to retest.
Oh, okay.
Oh
Okay.
yeah, and if machines are overeating, then definitely we will know not to release the results. Like I
Okay.
was
Okay.
mentioning about contamination earlier on, if the samples are contaminated, you know that you're going to send out erroneous results. So you definitely have to repeat. And the only issue is, the only time that we can't repeat is if there is insufficient sample to start with. You understand? And
Yeah.
then that's where the issues of you having to rebleed the patient, or send for another samples. But that's another topic entirely. But yes, if the machines malfunction, that's why we have preventive maintenance. They all we do, every day there's checklists for us to make sure that the machine is in working order,
Yeah.
before we start testing patient samples.
That is fabulous. Bami, thank you so much. How can people find you if they want to ask more questions, for instance, if they want speakers for their schools, for STEM, for universities, or even if they just want to have just some career advice around
Mhm.
what you do, where can they find you?
So I am on LinkedIn as Bamidele Farinre.
Yeah.
I'm on Twitter as Bami Precious, Bami, Bami Precious, the name Precious, Precious. I'm on
Okay.
Instagram as well. My Instagram, you might not find it as a biomedical scientist, because I'm a singer as well, a gospel singer. So you might find that as Bami Music.
Oh, okay. Are you going to leave us with a tune? I'm going to
Ah.
ask you that. I didn't know that. I didn't know that.
Oh,
So next time you can
yeah.
come and tell us what AI is helping you with your music and your voice and the
Uh-huh.
technology around that. Good. Listen,
Absolutely.
thank you so much, Bami, for sharing your experience with us and the knowledge around AI and ethics and the whole thing about technology. It's been fascinating, and I'm really, really grateful that you took
Thank
time out to educate us on this amazing technology and what goes on behind the scenes. And today, I actually know that there's a human washing my blood samples. I thought machines were doing all of that. So thank
I
you so
know.
much. I'm so, so grateful. And that has given me some comfort, actually,
Mhm.
that the machines don't do everything. And first of all, comfort that humans are still involved. And
Yes.
secondly, that the jobs will not disappear as a result, because it's people's families,
Yes.
people's lifestyles, and all of that will be affected.
Mhm.
So thank you very much. And for everybody else who's come on, thank you so much for tuning into Tea with Lily. As you know, I'm always here to bring ideas and topical issues so we can sit around, have our fire chat conversations, and answer those burning questions. And next week, we've just had our budget. So I've got Tim Aker from FSB talking about how the budget, the UK budget that went on yesterday, that the Chancellor gave yesterday, is going to help us unpick all of that next week. If you're in business and you want to know how the budget will affect you, for better or for worse, please join us next week. So, Bami, thank you so much
Thank
for
you for
joining us.
having me.
And for everybody else, including Bami and myself, enjoy your great International Women's Month. And may everything that you wish for be the least that you receive. Take
Yeah.
care and goodbye.
Thank you. Bye bye.